One of the biggest voices of truth, someone who is both a medical professional and a politician, a senator, has got himself in a lot of hot water for telling the truth on mainstream news. This is how it all started.
My next guest is a doctor and state senator in Minnesota who is deeply troubled by the CDC's latest guidance for counting COVID deaths. Dr. Scott Jensen joins me now.
I spent some time earlier today just going through the CDC's manual on how to complete death certificates and the parts that were specifically written for physicians. The determination of the cause of death is a big deal. It has impact on estate planning. It has impact on future generations. And the idea that we're going to allow people to massage and sort of game the numbers is a real issue. Let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days, and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate, and I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia. And in the contributing factors, I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death. And yet that's what we're being asked to do here. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do.
Now, obviously, we covered that exact issue. We were one of the first ones to report it here on the High Wire because you never hear these things in mainstream to begin with. I'm glad that Laura Ingraham has followed us into this story because it's huge. We know that the CDC changed the death certificate, said if you just assume that someone had COVID-19, make COVID-19 their death. You put that right at the top of the death certificate, and we finally had a senator and a doctor speaking out. Well, just about 2 weeks ago, Senator Dr. Scott Jensen put out a video that was very disturbing. I would say it was a flare shot off for all of the truth seekers and truth tellers across America. This is the video that went viral.
This is one of the most important videos I've made, and one of the hardest. Frankly, it's been a very difficult decision to make whether I even wanted to do it. Less than a week ago, I was notified by the Board of Medical Practice in Minnesota that I was being investigated because of public statements I had made. They listed 2 allegations. They said I've been spreading misinformation in regards to the completion of death certificates on a news program, which happened to take place on April 7th. And the other allegation was that I provided reckless advice in my willingness to compare COVID-19 and the flu. When I got this letter, I was ticked. And quite frankly, I leaned into the comfort and wisdom of my family to help them, let them talk me off the cliff. But doggone it, if this can happen to me, my view is it could happen to anybody. I mean, I've been a family doc for 40 years. I work hard, I love my patients, I do house calls, I've been medical director, I've held staff positions in hospitals to help make things work better. I've been in the Senate for 4 years and I've learned a lot. I've never had anything like this happen. Shoot a mile. 5 years ago, I was named the Minnesota Family Doctor of the Year. Do I feel targeted? Yeah, I do. Do I know who my accusers are? No, I don't get to know. If it can happen to me, I think, frankly, that it could happen to anybody.
I am now joined by former Family Doctor of the Year in Minnesota, Senator Dr. Scott Jensen. Scott, I have to say that watching this video, you know, we can think about you personally and say, wow, that doctor, you know, poor him. It's unfortunate that that's happening. But to me, it's like a science fiction movie or a Nazi Germany movie where somebody was reporting on the fact that we were starting to really see signs that free speech was being destroyed, that people who were telling the truth were being bullied, that media was no longer there to tell the truth or to save the truth. You know, it was a shocking video. What inspired you? You said, you know, I really thought about whether or not I should put out this video. Why would someone think to not put out the video?
Well, I think typically when you get investigated by the Board of Medical Practice, I think a lot of people would sort of see that as a badge of shame, and that you'd like to keep it as quiet as possible and go through the motions and cooperate and hopefully get some sort of a decision in your favor. I'll be very honest, I thought about doing it that way, but it just struck me that this is way bigger than a family doc in Minnesota being investigated because someone's trying to muzzle him. This is a conversation that really does deserve to take place on a national level and actually on a global level, because the heart of free speech and being able to share a contrarian narrative is at stake. And so I felt that if I just come out with it and say, okay, this is not going to be something that I'm going to run from. I'm not going to be wearing a scarlet letter. I'm going to wear it as a badge of honor and say, listen, what can happen to anybody that has a certification or a license through a regulatory agency, then so be it. Let's have the discussion nationally, because it's clear to me that if it can happen to me, it can happen to anybody. And so if I need to be the target for a while, so be it.
Now, I've talked to other doctors that have been through this before, you know, that have been under threat. But what I'm confused by is it seems to me that the medical board is there to determine whether you're practicing medicine correctly, whether you are taking care of your patients. It seems to me you come under, you know, real scrutiny when you make a mistake with a patient. Maybe you give them the wrong drug, you put them in harm's way. But this has nothing to do with the patient. This is simply a doctor, and by the way, a senator. You are a sitting senator and politician who I thought your job was to work for the public, to tell the public what's going on behind the scenes in every case, things that you may be voting on, things that involve our freedom. And so you spoke out about those things. It seems to me you could argue right away you were speaking as a senator more than you were a doctor, someone speaking for the people of your state and really the United States of America. But what authority does the medical board have over your speech? This has nothing to do with the patients. You clearly don't have a patient calling in right now and saying, I got hurt by something that was done by my doctor. Are you really not allowed to speak your mind? I mean, I think about how far does this go? What if you're sitting at a dinner table with another doctor and you're overheard by somebody, maybe a reporter, saying to a doctor, I think this death certificate's a little outrageous. I've never had to do this before. Should you be put up for medical board scrutiny, or maybe have your license pulled in? What is it? Should the medical board be involved in speech?
In the statute in Minnesota, the Board of Medical Practice is charged with investigating a variety of complaints. And from their interpretation of the initial allegations, they view this, and I understand where they're coming from because I did review the statute myself. I think the Board of Medical Practice views this as one of those areas that they do have an obligation to investigate. Were it someone complaining about the size of a bill or something like that, they wouldn't undertake that. But in this situation, they're saying, well, we do need to make an inquiry of this doctor, and I'm hoping that that's where it stops. But I think many states will have to think about whether or not they don't want to recraft the breadth and the guardrails with which the boards of medical practice operate. Because in fairness to the Board of Medical Practice in Minnesota, I think they're simply doing what they believe they are charged to do. And that's why I said that I would fully cooperate. And I know that they will keep things confidential. They will not share with me the accusers, but I do have the option of going public, and I did check with them beforehand, and I felt, okay, this is an important conversation to have transparently. But I agree with you. This has nothing to do with patient care. It has to do with public comments. And honestly, in terms of reckless advice, you want reckless advice, look at some of the things Dr. Fauci has said. And if you want misinformation, you look at the governor of Minnesota when he comes out and says that we're going to have 74,000 deaths, and then he reduces it to 29,000 deaths. And then he tells us we're going to have almost 1,000 deaths every day in July. Is that misinformation? I don't think so. It's a fluid situation, and he's giving his opinion.
And you, I believe, I mean, so let's look at the two allegations. The first one is that by comparing the flu to coronavirus, that's dangerous information. It's not accurate. What is your argument? I know what mine would be because I've been making it for the last, 4 or 5 months. But for you as a doctor, a physician, do you think maybe you overstepped by comparing flu to coronavirus and the rates of death and how the virus spreads?
I do not. I cannot help but be reminded of the movie in Forrest Gump where I think Forrest says, stupid is as stupid does. And that's what's going on here. Quite frankly, what do you want me to do? You want me to compare COVID-19 to syphilis or gonorrhea or tuberculosis or HIV or Ebola? I mean, come on. It's a single-stranded RNA virus. The symptoms of presentation are similar. The incubation periods might be somewhat different. The latency periods are still present for both. These are comparable. Dr. Fauci said in the New England Journal of Medicine that the COVID-19 disease is acting very much like an influenza outbreak. Dr. Mike Osterholm has said the same. This comparison is being made virtually every day. So to me, this is pure lunacy.
All right, and then the other accusation that is made against you is discussing the death certificates. Obviously, on Fox News, you came onto the high wire and discussed these issues with us, and we've been talking about it. The death certificate clearly changed. It basically said, we are going to change the way you've ever filled out a death certificate before. Now, even if you assume, then you should go ahead and put it, that it was caused by COVID-19. And it even had things in there saying, and we most likely will never review this, basically saying don't ever worry about it. But what's your argument about, was it dangerous to discuss the fact that the payments for calling something COVID-19, is there error in what you said? Is there anything you'd like to retract right now while you have this public forum?
I will retract nothing. The USA Today came out and fact-checked me regarding the comments I made in terms of Medicare patients and hospital payments regarding $13,000 for a COVID-19 respiratory disease or $39,000 if a ventilator is used. But I guess I would say this. When the Minnesota Department of Health said that we can go ahead and put the cause of death as COVID-19 if it contributed, that's where they went wrong. There is a separate box on the death certificate for contributing conditions. And in their language, the Department of Health said, you can put emphysema or asthma or COPD in the contributing conditions box. But if COVID-19 contributed, put that as the cause of death. That's just bizarre. This has never happened in 35 years of medicine and for me, and I've checked with hundreds of physicians and they've never seen it either. Contributing conditions certainly should be listed in the part 2 of the death certificate, but we are held to, as best we can, a precise sequence of causation. And the CDC says it in many places in their manual for physicians to complete death certificates. Start with the initiating event. So if someone has a heart attack, and the heart attack leads to congestive heart failure, and the congestive heart failure leads to pneumonia, and the pneumonia is capped by COVID-19 detection, the underlying cause of death is the heart attack. It gives rise to the congestive heart failure, which gave rise to the pneumonia. And in that situation, you could say the patient died of pneumonia, or you could put COVID-19 as the immediate cause of death. But the critical identification on a death certificate is the underlying cause of death. That's the diagnosis we use to determine how many Americans died of heart disease last year, how many died of colon cancer, how many died of renal failure. The idea that you can throw all the rules out, all the conventions out, and throw in COVID-19 is bizarre. It feels like we're being coached and massaged. And that begs the question, why? What's the incentive? Is there a hidden incentive here? People enough of this kind of death certificate diagnosis that Americans might not take it seriously enough? I don't know. There was no transparency. There was no discussion with physicians in regards to the Department of Health coming out and saying it. And the proof of the pudding, I think, is that a week later, the Department of Health came out and clarified things. And then 3 or 4 weeks later, they came out and clarified it again and attached a video to help physicians understand. And they stopped using words like assume, and they started using words like precision and specificity. And that's where they went wrong initially. And I think they understand that. That's why we've had Pennsylvania subtract death counts. That's why yesterday or today, Bowling Green, Kentucky came out and said, we're reducing our COVID-19 death count. And the Department of Health leader, the commissioner there said, we want to get it right. And he basically said something like, doggone it, if a guy dies in a car accident and happens to have COVID-19, it's going to be identified as a car accident and not a COVID-19 death. It happened in Colorado. I mean, I feel like I've already been vindicated, but now here I sit with my professional license being at stake. And frankly, Del, it hurts.
Well, it's got to feel terrible when you're just simply doing your job and you're great at your job. Nobody likes being accused of anything. And what really bothers me, and this is really from the point of view of a journalist, in order for me to be able to do my job, which is the job of the Fourth Estate as handed to us by our founding fathers, I've got to be able to find the data to double check and make sure hospitals handle this right, that we learn as we write articles and journals and papers and books going into the future. You know, journalists have got to be able to get down to the truth. I get it. We're in the middle of a panic. You know, we have a pandemic. People are moving really quickly, but science usually goes out of its way to make sure we get it right, especially how we're documenting it. We might have made mistakes on the front lines, but we've got to be able to go back and look and say, who really was at risk? Was it the heart attack people? Was it the people that had asthma? Was it the people that had motorcycle accidents? You know, what caused this? And it seems to me we are really dangerously close to wiping out such critical data so that in the future medical students and the future scientists that will need to study this moment to understand how to make sure that it never happens again, whatever took place here, their data will be so whitewashed with everybody putting at the top line the reason was COVID-19, that we won't have enough information to actually be able to do good science, to do good journalism. Do you agree with me on that?
I agree with you completely. And I think, frankly, I've been disappointed that more physicians haven't come out and said, hey, this has got to be straightened out. The CDC dropped the ball. Many departments of health have. I think the departments of health in various states have been more nimble and said, okay, there's a problem here. We're going to fix it. That's why we're seeing the Pennsylvania, the Colorado, the Kentucky situations. I don't think we're seeing that same situation in New York, because I think in New York, they felt that during a certain period of time, there were more deaths. And so they must have been COVID-19 deaths. And I think that's a terrible assumption to make. And then when we start to see federal dollars and state dollars distributed based potentially on the number of COVID-19 cases or COVID-19 deaths, this even further fractures the public trust. Frankly, the public is not buying what the public health officials are doing.
Yeah, we're hearing a lot of that in the news. We're seeing it, that the trust by the American people, we're watching it. It doesn't make sense. And so what is the real cautionary tale here? What is it that you want to see changed? I mean, the medical board has its place. You've said it over and over again. I have no problem with the medical board. Complaints have been made. I've got to stand up to that. We really have to question where these complaints are coming from. There's a real bullying now, whether it's, you know, people on Facebook or YouTube or, you know, different institutions that are reaching out, trying to crush anyone that's telling the truth. You know, my question is, first of all, these medical, you know, death certificates, it's not private information. It's not like a doctor is sworn like you're not allowed to share the death certificate information and how it works. You don't work for the government. This isn't top secret. What is the true cautionary tale, and what do you want to see as the outcome, both in your case, but also in how we move forward in the way we treat physicians that want to talk about evolving the thinking inside of hospitals?
Well, I think it's twofold, Dale. I think first, in America, there's got to be room for a contrarian narrative, one that is more skeptical and doesn't necessarily come from the same echo chamber that many of our governors might sit in. That's one. But I think the second is this is a lot more important than a family doctor who sees patients in Watertown, Minnesota, and who happens to be in the state Senate. This is about every American. If you can see regulatory agencies weaponized to be used against you by activists, this is a problem. So again, if I need to be held up in some sort of disparaging way where my reputation may be besmirched, so be it. The bottom line is, whoever did submit the complaints against me
I think they picked the wrong guy. I can be a pit bull. I am a skeptic. I do a lot of reading. And I'm not backing off.
Good. Dr. Scott Jensen and a senator, I mean, it really is shocking. If this can happen to a sitting senator, an award-winning family physician, then it truly can happen to anyone. I, for one, I think I speak for a lot of people that thank you for making your decision and taking the option to bring this to the public versus hide and try and deal with this on your own. I want you to know that I believe a lot of Americans across this country and probably humans and citizens around the world are standing with you. Thank you for your courage, and I look forward to speaking with you on the other side of this, where I'm sure you will be vindicated. Thank you, Scott.
Thank you, Del. I appreciate it.
If you liked that clip, then be sure to check out our live broadcast of The High Wire every Thursday morning at 11 a.m. Pacific Time. You can watch it on Facebook, YouTube, iTunes, and Twitter. We'll see you there.